Well, good morning, everybody. Thanks for taking time out of your day. But this is Taylor with Western Marketing. We're gonna go ahead and we're gonna start this webinar here. I got Mr. John Johnson with Allstate Benefits. He's going to be going over all of their voluntary benefit line products on the group side here, and then we will be having the team from EasyAppsOnline hopping on when he is done, and they're going to be going through kind of showing their system on how to do group. Without further ado, John, go ahead and take it away.
Taylor, thank you very much. I appreciate everyone taking time out of their day today to get on this call. As Taylor said, my name is John Johnson. I'm with Allstate Benefits. I'm the sales manager in Iowa who supports Western Marketing. So I work with Taylor and Sandy and Tyler on an ongoing basis to support Western Marketing and all of their producers and agents across the country. So today we're going to go through some information on positioning our plans, how plans fit in with the benefits that you might already be putting in place with your employer groups. And I'll just state that everything that we do on this side of Allstate Benefits is voluntary employee paid benefits. They're designed to enhance the benefit plans that are in place already, not to replace major medical, because I want to point out this is not major medical coverage. So I'm going to take a leap here and see if my technology skills are vast enough to show my screen. And let me see. Taylor, can you see my screen now?
Yes, sir, we can see it.
Is it the one that says Allstate Voluntary Benefits, Talking Points, and Positioning?
Yes, sir.
Wow, well, wonders never cease. So, okay, I cleared the first hurdle today. So really, I want to start out before I even talk about products, because we're not going to go into a lot of detail on the products. We're primarily going to talk about how they fit into groups and why they're needed in groups. So I always start with the why. Why do we need voluntary supplemental benefits in groups? The thing that I always point out is when I go down and we look at the reality of the economic environment for our groups and their employees, the average income in the United States is a little under $60,000. The median household income in the United States is $8,000. So I want to point out the difference here. The median income is $8,000. So half of all households in the United States have less than $8,000 in savings. 22% of Americans have less than $1,000 in savings. And when we start looking at age groups, millennials, 52% of millennials have less than $5,000 in savings. So when we look at the medical plans that employers are putting in place today, if you look at the deductible, the individual and the family deductible, and you look at then the total out-of-pocket expense, when you add in the co-insurance once they've met the deductible, the vast majority of Americans don't have enough money to get sick or injured and have to use medical care. My plan at Allstate, I have just simply I have a very high deductible health plan for our family. It's just me and my wife. We have a $9,000 out-of-pocket exposure every year. So $9,000. I know that's very high. I choose that, but the averages when I talk to agents for individuals ranges. I'm hearing from $3,000 up to $5,000 for an individual, and oftentimes doubling that for the family. So when we have a situation where we are all as an industry putting in major medical plans for employees, we're really on one hand, we're giving them a false sense of security. And on the other hand, we're putting in an insurance product that they probably can't afford to use and may likely have to declare bankruptcy before they ever receive any benefits. And that just doesn't work. So what do we do? What are the options? And the options are supplemental health plans. Ideally, we've got coverage for accidents. We've got hospital indemnity coverage. We've got critical illness coverage that covers specific events like heart attacks and strokes and cancers. There's short-term disability coverage. And then we get into the life insurance. But I want to focus, first of all, on the medical plans. The purpose of these plans is that they pay benefits. For example, the accident plan will pay a benefit when someone has an accident. We typically provide coverage that's 24 hours on and off the job. When they have that unexpected event that sends them into the urgent care or the ER, our plan is going to start paying benefits. And those benefits are paid directly to the policyholder. We do not pay the provider. We pay the policyholder. We pay the provider without regard to what the medical plan may or may not pay, what workers' comp may or may not pay, and whether or not they even have those. If somebody's injured playing in a softball game at a family reunion, obviously the workers' comp doesn't come into play, but the medical plan will. The purpose of those benefits is to help fill in the gaps of the deductible and the co-insurance. When our children were young and at home, they were all in sports. We were a heavy user of our Allstate accident plan. We had dislocated knees. We had broken thumbs. We had teeth knocked out. We had a severe eye injury, all as a result of sports. The accident plan helped fill in that gap and did a wonderful job. The hospital indemnity plan is a very basic plan, very easy to understand. If somebody is hospitalized, doesn't matter if it's due to an accident or an illness, there is a benefit for the first day that they're hospitalized, and then a daily benefit. The first day benefit usually is either a $500 or a $1,000 benefit, and the daily benefit is usually in the range of $100 to $200 per day. Very simple plan. The trigger for benefits is a hospitalization. Again, it could be due to an accident, could be due to an illness, could be due to a pregnancy. I want to point out that there's a 10-month waiting period for pregnancy benefits on our plan. These plans, again, they do not coordinate with medical insurance. They do not coordinate with each other. Somebody could have an accident plan with us and a hospital indemnity plan with us. If they have that accident and as a result, they're hospitalized, both plans will pay out. And again, we pay the benefits directly to the employees. Critical illness plan, I'm older, I'm past middle age. I worry about heart attacks, I worry about strokes. This plan pays a lump sum benefit. So if I have a heart attack, or if I have a stroke, or I have a cancer diagnosis, I have a $20,000 benefit on my plan. Based upon the diagnosis, I'm going to receive that benefit. I get to use those funds in any way that I please. I can use them to pay the deductible and the co-insurance. I can use them to pay for travel expenses if I'm going places for treatment, or I can use them for any loss of income. So again, the positioning is in your medical plan, you've got, for example, a $3,000 deductible and an 80-20 co-insurance, which is pretty typical. The problem is your employees make an average of X number of dollars per year. They need a stopgap to get to that benefit level, so they don't have to have any undue medical crisis, perhaps even declare bankruptcy on that. So that's how I position these. On the life insurance, I know because I look at LIMR reports that as time goes on, fewer and fewer households have their own privately owned life insurance. Most people today rely upon the insurance, the life insurance they get through their employer. And all of you that have groups where that employer is providing employer paid life insurance, think back over time and try to recall how many times employees have left the company and they've reached out to you and they've said, hey, I need information on how to port my life insurance policy from my employer. It really just does not ever happen. So that group term life insurance is wonderful coverage while they're an employee, but it does them no good when they leave and they leave it behind. Our group options, there's a whole life option that we typically quote with long-term care, which is another webinar that we'll do. And we have a very simple group term to 100 where the premium stays level through that person's age 100. Whether they buy it at 25 or 60, the premium stays level. These plans do not have to be converted. Like the other plans, they are simply all portable. They move from payroll deduction to bank draft. So that's a quick positioning on the plans. And again, I didn't want to go into a lot of detail on how the plan works, although I'll show you some very quickly here. So now you've got a group, you've talked to them about the issue with the out-of-pocket exposure, and can their employees really afford that? And you all decide that no, they really cannot. So interested in putting in the plans. What next? Well, number one, you have to make sure you're appointed with Allstate voluntary benefits. For those of you that might be selling Allstate level funded medical plans, it's a different contract. The insuring company is actually a different insuring company. So reach out to Taylor or Sandy or Tyler. Make sure that you're appointed with Allstate voluntary benefits. Next, when you look at that group, we do not, everything that we do on the policy side, so the plans themselves for the employees, everything is done on a guaranteed issue basis. We don't require the individual employees to provide any evidence of insurability. We don't ask their height, their weight, if they've had heart disease, if they've had cancer, we don't ask that. We look at the group. So one of the things that Taylor and the crew there have access to is our restricted industry list that I'm going to toggle over to. I'm going to take a drink of water. Taylor, any questions so far? I put you on the spot.
Yeah. No, you're good. Looks like we do have one. Looks like it is regarding the hospital indemnity. How much can a person purchase for the first day of inpatient stays? And then is there any outpatient riders available to help with the deductibles?
The plan, all the plans that we have configured in our portfolio that we're going over are designed to be compliant with high deductible health plans where there may be health savings accounts. So because of that, we have to be very careful about what benefits we put on that hospital indemnity plan. So it consists, it's a very basic, very inexpensive plan that consists of an initial hospitalization, and we can, there's a high-low option. Low plan for the first day is $500. High plan is $1,000. And then the daily benefit is on the low plan is $100. It's also $100 per day on the high plan. That initial hospitalization benefit is payable once per month. So if somebody had a second and even a third or fourth hospitalization during the year, as long as they are in different calendar months, we would pay that initial hospitalization each time. If they have a second hospitalization during the same month, the daily benefit is paid for 10 days per hospitalization, which the average stay is about 4 days. So it more than doubles up the average stay. So we're comfortable with that. But if somebody had a hospitalization in the same month, they are eligible once again for those 10 days of daily benefit, but not for the initial. If it's a different calendar month, they would be eligible for the initial. Taylor, let me know if there's a follow-up on that. But I want to cover the prohibited and restricted industry lists. So when you have a group, we underwrite based upon the SIC code of the group. If that group is on this restricted industry list, I want you to think of it as a yellow light, a caution light, not a red light. For example, you can see that trucking companies are on our restricted industry list. However, I will tell you that we write a lot of trucking companies. We love trucking companies. The reason it's on the list is that a lot of trucking companies have both W-2 employees, and oftentimes they have independent owner operators that are 1099 employees, contract employees. We are only able to offer coverage on W-2 employees. So the reason trucking companies are on this restricted industry list is the underwriters want to make sure that you and I have a conversation and that the group knows that only their W-2 employees are eligible. So we end up writing about 75 to 80% of the groups that are on this list. So again, it's a caution light. If they're on there, send an email, pick up the phone, call Sandy, Taylor, Tyler, or reach out to me, and let's go over it, because most likely we're going to write that group. So now the group is not on the restricted industry list, or we've had that conversation. What next? Quick step back. If you don't have the SIC code, I can typically find it. I use a couple of different places. These are websites that you can go to. BuzzFile is a very good, easy site. You really just I need the name of the company and the city and state where they are located. And from that, I can typically find the SIC code. Next, how do you decide what to offer into a group? My biggest piece of advice today is that initially restrict the plans that you're going to offer to 2 plans, no more than 3. If you go in and you say, well, I want to offer the critical illness, the accident, the hospital indemnity, disability, and life insurance, that's too many options. It's too difficult a decision for employees to make when they are flooded with information, with too much information. Their fallback position is they make no decision, and so they do nothing. So I tend to look at the demographics of the group. Is it a high activity occupation? Or is it a plumbing group? Is it a electrical contractor? Is it agricultural related? Are they active? Is it primarily male dominated employee group, or female? Are they young? Are they old? So I look at all that information from my perspective and say, okay, if it's an accounting firm or a law firm and the average age is 52, they're sedentary, and they're primarily male, in a group like that, I would steer towards the hospital indemnity and the critical illness. If it were a group of employees that were primarily male that are younger and they're active, it's a plumbing contractor, and those employees are typically active on and off the job, then I tend to look at the accident policy as the lead. I do like the hospital indemnity because, again, when they're younger, a lot of those people, even if it's male dominated, they're going to be married or they're going to have a partner. And a lot of times they're going to be in the period of life where they're contemplating or having a family. And then this is the hospital indemnity plan is a great plan to put in there. And the same would hold true if it's a highly dominated female group. I tend to look at that. But keep in mind, individuals have to have that hospital indemnity plan for 10 months before we pay benefits for a pregnancy. So now that you've decided that maybe you're going to offer our accident plan and our life insurance plan, because they don't have any life insurance coverage in there, or it's minimal, or you've never had anybody come to you with questions on how to port that coverage over. So you've made a decision, you're going to offer accident and life insurance. What next? How on earth do you get this enrolled? In a few minutes, I'm going to turn it over to the team from EasyAppsOnline. We can provide you an enrollment platform that will allow you to do the enrollment on an agent-assisted basis or a self-service basis, where you can do a presentation of the plan options to the employees, provide them with login instructions, and let them go out to that site and enroll on their own. And you need to be registered with EasyAppsOnline. You can just send me a request, or Taylor or Sandy, and we'll get you registered with their team. They'll get you your unique username and password. They'll even do training, which I think we'll probably end up doing enough training this afternoon. You'll see how easy it is. Let us know if you need brochures. If it's a very small group, you can absolutely print off the brochures that I just showed you. If you'd like to have a supply of brochures, let us know. The minimum amount I can print and ship is 50. Happy to do that. Just let us know, and we will get those out. If you use the Easy App system, which I highly encourage, there are digital copies in that group, in that system. Eventually, I'm going to need some information on how to set up the group. Initially, I need the group name, their address, how many employees, what products you're going to offer, the anticipated or requested policy issue date, when you're going to start the enrollment and end the enrollment. Are you going to use paper enrollment forms? Please don't. Or EasyAppOnline. And let us know who all is going to be involved in this. Are you working with a partner? Or is all the commission going to come to you? Are you also going to be the servicing agent? If you work with a partner that might provide the servicing on the group, do we need to pay them directly? Because we can split up how the commission is paid. And again, if you need printed copies, let us know. 7 to 10 days, 10 days is better. But you can send this information to me, and I would also have you send it to my onboarding, my implementation person at AB IMP implementation, ABIMPNCT@allstate.com. That will at least get us the group number and get that system initially set up on our end. So we can provide that group number, and the Easy App team can build it. And as they will point out here shortly, they will build that group for you on the system. You don't have to become a programmer. Eventually, we are going to need a customer agreement document. So I'm not going to spend a lot of time going over this, but really we need the effective date. I always recommend doing the first of the month, just because it makes the payroll deduction process much easier. The site estate is the state where that group is located, their federal ID number, the business name, the authorized officer of the company. If it's a small group, their onboarding contact, the person we might reach out to if we have questions, it's usually going to be the same person because they're the owner. If it's a larger group and they have an HR person, that's typically going to be the HR person. The requested plan year. So are they going to start June 1? Then we'll have a May 31st, June 1 to May 31 plan year, or is it 1/1 to 12/31? So just let us know there. Are there subsidiaries that need to be included but maybe billed differently? Let us know. The total number of eligible employees. We allow employees to enroll, both full-time and part-time, those who work 20 hours a week or more. The group can say, hey, I only want this for employees that are full-time, working 40 hours a week. Great. You can fill that out in other. The annual enrollment period for the group is the calendar month before their policy anniversary date. Let us know how many days an employee has to work at that company before they're eligible for employees. That could be 0 days, or it could be 30 days, could be 60 days. I always recommend that their coverage start on the first day of the month following when they're eligible to enroll. Again, keep everything the first of the month. If they happen to have, at the initial offering of the plans, if they have employees that are still within that 30-day or 90-day window, they're not eligible, you can choose to make them be eligible right away or wait. Billing information, we need to know where's the bill going and to whom. Sorry for scrolling down. We need to know their payroll frequency. Are they paid weekly, bi-weekly, semi-monthly, monthly? Because we will configure the premiums as weekly amounts or bi-weekly amounts or semi-monthly amounts or monthly amounts if they just want monthly. I will help fill all these out for you. I'm not going to expect you all to know these from the start until you tell me you are comfortable doing it. I'll put all the basics of these in here, and then I'll send it to you for signatures, because sorry for the scroll, we need the company to sign and we need you to sign. You would be the servicing agent, the other agents down here. Okay, so with that, Adam, Patty, have either of you been able to join it? And
yeah, we're on, both of us.
Okay, so I am going to do a quick introduction. I'm going to stop showing my screen. And Taylor, can you see? I don't know if you'll have to do anything to allow Patty to share her screen, but Patty Fraley,
Yep,
and is Adam with you as well? Is it just you, Patty?
Oh, no, Adam is right next to me, so just a minute, Will.
Yeah, you should be able to see our screen now.
Yep, we can see it.
Okay, so I want to introduce you all to Patty and Adam. They are with a company called EasyAppsOnline. Now, although it shows Allstate benefits front and well, not front and center, but on the screen, EasyApps is a separate company. They're not owned by Allstate. I will tell you, however, that they are perhaps our best partner from an enrollment platform standpoint. I know that we do business, we receive enrollment data from about 150 different enrollment platforms. There's a lot of them out there. I can tell you that we have more groups that use EasyAppsOnline than the other 149 combined. It's very easy. When you have two Allstate voluntary benefit plans in your group, we will provide this to you at no cost. No cost to you, no cost to your employer group, and you can enroll other than Allstate benefit plans. You can enroll their core medical, dental, vision, disability, life. And I want you all to know that we do not, on the Allstate benefit site, we do not have access to any of that data because you're working directly with EasyAppsOnline. So just know that there's a firewall between us. We don't have access to your group information. The only thing we get access to are the people who enrolled in our plans. So with that, Patty, Adam, I'm going to turn it over to you. I'm going to mute out and take a drink of coffee.
Hey, John, before you do that real quick, as far as product lineup here, I just want to make sure I'm kind of keeping it in the realm of what would be familiar. Just do maybe like an accident, whole life. Is that kind of in the realm?
Are they like term?
Yeah, why don't you do the 2.0 on the group accident 6 and the group term to 100.
Absolutely.
Okay, good.
Will do. I will do that. Thank you so much, John. Appreciate it. And hello, everybody. Thank you so much for taking a few minutes here to take a look at the EasyAppsOnline platform with us. We're really excited to show it to you. And as John has said, we have such a great partnership with Allstate, and now we have enrolled. We're getting near the $80 million mark as far as premium that we've enrolled since we started our partnership with Allstate. So,
a couple years ago.
Yeah, just a few years ago we've done that. So it's been nothing but success all the way around. We're in the 95% percentage on active participation on these products, and you're going to see why. created some really great strategies from an electronic enrollment standpoint to be able to make this very easy for employees to learn more about these products and to allow them to easily select these benefits, as well as even enroll in other benefits outside of the Allstate repertoire, as John had alluded to. So with that in mind, I did want to kind of start by just talking a little bit about the process flow, because this is one of the things that makes us very unique. With our system, EasyAppsOnline provides what we even like to refer to it as like a concierge service, where we truly will actually do all the implementation and all the setup for each of your cases that you bring to us. All we ask is that you provide us with the paperwork for each of the new groups that are going to be using EasyAppsOnline. We will also provide you with the ability to load a census, so we can actually upload a census with a lot of the employee information right up front. And what this will do is it'll actually provide a very quick and easy way for you to go through the applications. If you're going to be doing like an enroller assisted environment, we can truly preload about 40% of the employee demographic information. So essentially what you'd be doing is going in and just enrolling them and picking their benefits with the employee versus any of that data entry aspect of it. Now, we are very lenient when it comes to the census information. So if you're only able to collect from the employer, let's say the name, birthday, and gender from the employees, that's perfectly fine as well. We can upload a census with just that minimal information. And then you can, of course, as you're going through the application, or if the employee is self-enrolling, they'll be able to fill in any of the gaps where the census wasn't able to pre-fill. So we just want to keep in mind that, our team will provide you with with that hands-on implementation service where we will set up the case. We'll assist you with loading out the census. We only ask that you write the business, and that's really all we want you to focus on. We'll take care of the rest for you. So as I mentioned, the application or the group information, the group paperwork, that's truly the first step in this process to get that information over to our team. And once we have that information, we will go and we will set up the case. And then once you log in as an enroller or an agent, you will see those groups right here on your My Groups page. Each of the groups will have a few different buttons next to them, such as like group settings, products, employees, and of course submit. Our team will take care of the setting up the group, setting up the products, and submitting the case. So what you would be responsible for when you come in here is just clicking on that employees button. And when you click on the employees button, anything that we were already preloaded via census will already be on this screen. So if there is a list of employees that you had provided us, they will already be in here waiting for you. You'll see their name. Next to each person's name, there will also be a status, whether they've completed it or have not completed it yet. And to the right of that, you will see a button next to each person that says enroll. And that's just as you would expect, the link you would click on to start enrolling each employee on the EasyAppsOnline platform. So
now, one of the things that I like about the enroll button, you don't have to worry about passwords. You don't have to worry about security questions. And Adam clicks and in we go.
Yep, that's right, exactly. So we're going to go ahead and do that. But before I actually go in and actually go through the employee application, as John had mentioned, this system does provide different methods of how an employee can be enrolled. And one of those options is for an employee to do self-enrollment. So we wanted to also allow you to see specifically on the screen, 1 second here, there's going to be, there's a manual that you can actually provide the group. And this is just simply a way for employees to go out to the website from their phone or their laptop or desktop computer, and they can actually enroll on their own. We know a lot of times, you may not be able to connect with every employee when you're on site. So this is a way for you to be able to provide them with the ability to go out and do their enrollment from this, from the comfort of their own home, from their phone. They just simply scan that QR code and that'll take them to the portal where they can log in. And there's a couple of different ways we can do this. Obviously we would like to load a census for each and every group if possible, but we know that's not always going to be an option. So we do allow for you to provide groups with what we call self-registration instructions, which allows them to get a special company-specific code to enter on the website to create their own account and register as a new employee under that company and essentially add themselves to the census. This usually kind of comes into line when we talk about onboarding employees throughout the year. But there are times, as I mentioned, where you're not able to collect or capture a census from the employer. So in that regard, you'd be able to provide those employees, if they're going to self-enroll, with the ability to register and enroll from their own device. What we're going to go ahead and do at this time, though, is we're going to go ahead and take that step that we just had mentioned, where we're going to actually sit there with the employee and we're going to enroll them. So when you click that enroll button by their name, it's going to take you into the employee application. I have a test person here already set up for this demo today, so we're going to go right into it. First thing that you're going to see when you go into the employee's application is that there will be a page called My Information. Anything that was on the census that was preloaded will carry over here. Anything that had not been pre-filled in yet will be clearly marked with a red box, and it will say that it is a required field. If you try to continue forward without entering all the required fields, the system will stop you and let you know what you need to correct. Another thing I wanted to also mention about the interface is that we do provide a language option at the bottom for instant translation to Spanish. Any groups that may need that, it's there, it's instant, and it's powered by Google Translate. And for anyone that may require any support from the EasyAppsOnline team, right at the top of the screen, we do have an option that says support, and they can click on the live chat button, and they can talk to the EasyAppsOnline team through a live chat window. And that way, if they have a question, they can ask us right here in this window, close it and move on without ever leaving the application. That's available Monday through Friday, 8:30 to 5:30 Eastern. We're based out of Cincinnati, Ohio. So, we provide that unlimited free support to each and every employee, each and every agent, each and every employer that uses our system. All right, continuing on with the application now. And if anybody has questions as I'm going through, feel free to use that chat window. I do have it up here, and I can see any questions that you would ask me, and I'll make sure to address them as we go through this. Now the employee information has been keyed in on this first screen. We're going to hit continue. It'll take us now to the employment screen. On the employment screen, we are going to collect, again, anything that is required. And many of these fields, again, could have been preloaded from that census. And then we're going to click continue to move forward. The following screen is where we would enter any dependents that are going to be covered on the benefits. This would include spouse and any children. So one thing we always want to kind of point out is if you're not including any core benefits such as medical or dental or vision, where you would not require an actual social from the dependent children, we do allow you as an enroller, if you're keying these employees in, you can key zeros in for the children's social security numbers, because a lot of times they may not be able to provide you with the social on their children. And so therefore you can go ahead and put in zeros. Our system does allow that. Again, as long as we're not enrolling any, like major medical products in the system. So once we've entered in all of our dependents on the screen, we're going to move forward. And we're going to be taken to the coverage page. So on the coverage page, what we're going to do here is we're going to click elect or waive. So each product does have an action item next to it. And as you interact with each product, this action item will change, and you'll see that here in a moment. So we're going to click elect or waive on it. It's going to bring up a marketing screen for this particular product. It's got a media-rich information here, including videos, brochures, and usually we'll have some benefit information here, including frequently asked questions about the product. It will then go down and break down the actual product in the per pay period. So in this case, I did set up my demo group in a weekly format, so that way that the payroll deductions would show in a weekly. And that's where we're seeing these breakdowns right here. So the accident plan has a low and a high option. All we need to do is simply choose one of our coverage types here, which is employee, spouse, children, and or family. And then we do have the plan 1 or plan 2. Now, if they do not wish to opt in for this product, there is a link right below the coverage that says I do not wish to participate. That would waive the plan. But I'm going to go ahead and elect that family coverage at, and we'll do plan 2 on that and hit continue at the bottom. Now, once we've enrolled in this, we're going to be taken now back to the coverage screen. And as I mentioned, each product will have an action button next to that. Now that you can see, it says modify, and it's taken that product that we've elected and added it to our cost summary on the right, which will keep track of our deductions as we go through each product. Let's go ahead and move down to the whole life insurance. Now, the whole life insurance is going to, first of all, it's going to, again, just, what's that?
I think he wanted term.
Oh, they did say term? Oh, I'm sorry. Let me go back and change that. See, this is actually something that's, it's good.
No, just, you can leave it, the whole life is just fine.
Oh, okay. I was gonna say it's good how easy I can show you guys how easy it is for us to fix this.
Okay.
On our end. It's very quick. We just go in and we add it, we removed it there, and then all we've got to do now is just simply add that product right back in. So I removed the whole life, and I just come in here and I can add the term. We've already have these all pre-built out, right? So it's very easy for us to go in and actually update these products. Just wanted you guys to see that. I mean, it's a real world item, right? Sometimes they change their mind and they want to go from one life product to the next. So we're going to go ahead and we are going to go back into our test employee now. And now you're going to see that product that I had in there has been swapped out with the term life. So just like the whole life, the term life does provide, again, a marketing screen here with all the information about the product, videos, brochures. And as we get down here to the where we're going to actually interact with the benefit, it does require us to confirm the employee is working at least 20 hours a week, as well as their spouse, making sure that the spouse is working at least 20 hours a week. The spouse's actively at work status will impact how much life insurance they're eligible for on this benefit or on the page. So let's start with the employee. The employee starts at a $10,000 option, goes all the way up to $75,000. And as we click on that, you can see each option does provide a cost associated with it. So you can clearly see what that's going to cost them when you're on the drop down. So we choose how much we want, up to $75,000 on this product, guaranteed issue. So no health questions are required. The spouse can go up to $30,000 in benefit, again, all guaranteed issue. And then finally, we have a child term rider option, which is either $10,000 or $20,000. With the child term rider, it does allow them to sign up any children under the age of 18 for a benefit. Once they have enrolled in the child term rider, they're able to stay on that benefit until the age of 26, where it would then need to be converted to an individual product policy, which will allow them typically to go up to a 5x. So, 10 would give them up to 50,000, 20,000 would give them up to 100,000 on an individual policy. All right. And as we continue down here on the screen, you can see the cost for the products, the employee, the spouse, and the child term rider. We'll total it up for us per paycheck. Do we have a couple questions on here that want to confirm whether the employee is replacing any coverage or the spouse is replacing any of that coverage as well with it, or they're replacing any existing individual life insurance already in force? I'm going to go ahead and answer those questions, and then we will continue forward. All right, so on the right side, we can see our total costs for everything, accident and life, brings us to a total of $26.40 per deduction. And we're going to move forward by hitting continue at the bottom, but you can clearly see that there's a modify button if they wanted to change something. It's very quick and easy to do so. Now we're on to the beneficiary screen, where we're going to go ahead and add the beneficiary for our first product. Now, one thing I want to let you guys know and just keep in mind with the beneficiary system is that you do have the capability of adding multiple beneficiaries. However, if they don't want to, that's fine. They can just enter one. We do have a little slider here that allows you to change the allocation. If they want to add, 2 at 50-50 or additional beneficiaries on top of that, they can split it however they so choose. It'll just keep track and make sure that they're allocating exactly 100% on that benefit. So we're going to go ahead and key in our beneficiaries information. We only need their name and relationship. We do not need a social or a date of birth. Those are optional fields. And then we do have a little option down here that says apply this beneficiary to all my benefits, which is really great. It allows us to kind of reduce the data entry, and it will copy this information across any of the other products that the employee has. Now the spouse, because the spouse is enrolling in the life, do get to indicate their own beneficiary. So I'll go ahead and make that the employee John Doe, and we'll save that. So we've entered our beneficiary information. Now we're going to continue on to the next screen. The next screen is simply a review page. The review page is going to essentially have the employee or the enroller counselor actually confirm the employee's information to make sure we've collected everything without any typos, any data entry issues. So we'll see all the information here is correct. You will notice that there are a couple questions at the top. These are producer questions. The system has detected that this employee is being enrolled with the assistance of an enrollment counselor, and it does ask these questions only when the enrollment counselor is present. And again, these questions are just confirming that the employee is not trying to replace an individual life plan that they have with a different carrier. They're not trying to replace that with this particular Allstate group life plan. So we're just going to answer no on those, and then we're going to continue forward at the bottom. At this point now, all we need to do is just review the terms and conditions and hit continue at the bottom. There will be no signatures for these group benefits. So with no signature requirements, you could essentially even do this virtually with the employee and or over the phone. We see that a lot, just because the group products don't require that signature. So you could truly do this in a virtual environment with the employee. And all we need to do is just hit the submit button at the bottom. This is just an online authorization. At this point, the employee will receive an email from EasyAppsOnline. It's what we call the enrollment confirmation. I do have a sample of it. It's not particularly for this employee, but it does provide you with an idea of what that email looks like. So the email will go right to the employee's email address, and it breaks down each product that they've enrolled in, what coverage amounts, what their cost is, and when that coverage goes into effect. So each employee will receive one of these, which is nice. It's right to their inbox and allows them to confirm, exactly what they've been enrolled in EasyAppsOnline. At that point now, you can go ahead and log out. The employee will have a log out option. We also have a view benefit summary button here, which allows you to pull a copy of the employee's information in a PDF format. This is just a 2-page PDF confirmation of what was entered on the EasyAppsOnline platform for this employee, demographic information, dependent, beneficiary, as well as their election data and their deductions. So these are available 24/7 for each employee that you've enrolled. You can pull these whenever. And again, the employee gets an email confirmation with the election data. So once we've exited out here, I can go ahead and hit the back cancel button to go back from our test account. And then at the top of the screen, we just hit the back button. But just keep in mind, each employee that you enroll will immediately show an enrollment status of complete and a link to their benefit summary if they are completed. And then you would be able to just go right to the next employee and just repeat that process and get everybody enrolled. It's very quick, very easy. We provide free unlimited support to each and every one of you that are using our platform. So you'll always have somebody here to ensure your success with the enrollment. I did want to mention one last thing here on this screen. On the main menu, every group that you enroll in here, we do provide some very robust reports. One of the reports that you can run is what we call the custom report. And this one allows you to create not just a deduction report, but a lot of times what people refer to as a data verification report, where not only does it contain the deductions, but any other fields that were collected during the EasyAppsOnline platform process and confirmed with the employee, including maybe an updated address or a phone number. These are things that are very helpful for the employer when they are updating their own internal system. They can review this deduction report along with any other fields included on that report, and they can update their side if there's any changes to their address and things like that. They can confirm it. And as you can see on this report, I'm going to just zoom in a little bit here. You can see each product is outlined on the benefit report, including their coverage and cost. And at the very end of the report, you're going to see there is a total premium, deduction period, and then whoever took that particular application, the enrollment counselor's name will be present in that enrolled by column. So that's it. So at the end of open enrollment, once everybody's done, our team will be notified by somebody on your end, whoever's the point person for the group will reach out to our team, let us know you completed open enrollment. We will submit that business to Allstate. And then what we'll go ahead and do is move that group into what we call new hire mode, which is just a fancy way of saying ongoing or perpetual enrollments throughout the year. You'll be able to continue to use it for adding new hires, as well as even submitting qualifying life events. And you can even terminate the employee through our system if their employment has been terminated. We can send that termination notice to Allstate to get those policies terminated on their end as well. Any questions?
Adam, this is John.
Yes.
So when they got that group done, the initial enrollment, introducing these benefits, do they have to go over and click the submit group, or do you prefer just getting an email from the agent?
So I would actually prefer that they send us an email, and the reason why, it's kind of twofold. Not only will they not have to go through the submission process if they email us, but what we'll do is once we get the email, we can go ahead and take a look at the group, do a little auditing our end to make sure everything is good, and then we'll go ahead and submit everything on their behalf and move that group into that new hire mode on their behalf as well. So they don't even have to worry about the submission, the migration to new hire mode. We will take care of all of that on their behalf, and then communicate back with them via email that everything's been submitted and the group is ready for perpetual enrollments throughout the year.
Perfect. Thank you.
Yep. And those new hire apps that you enter throughout the year are automatically fed to Allstate. We do this weekly on Thursdays. So, once open enrollment's completed, you no longer have to email us anymore. When you have an enrollment in the middle of the year, it's fed automatically on Thursdays to Allstate.
Great.
Any other questions?
Taylor, are any questions come in on the chat?
Nope, nothing.
Okay. Well, I guess with that, I'll thank Adam and Patty and hold on in case we have some come in. But Taylor, I'll turn it back over to you if you have questions or if you want to go ahead and wrap it up.
Yeah, no, definitely. Well, no, thank you everyone for coming in today, and I do want to thank John and all of our presenters here today for running through everything. If you have any questions or if you need to get set up with anything, definitely feel free to reach out to either myself or Sandy. You guys should all have the phone number. If you don't, I'll be sending something out afterwards. But yeah, besides that, everyone have a great day.
Thanks for setting it up, Taylor.
Thank you. Take care, everybody.
Bye-bye.
See ya.
Bye-bye.